We all have questions and concerns about returning to campus. And as we continue learning together, we're leaning on Pitt experts to make our campuses among the safest places to be in this pandemic. The good news is that we're starting to develop answers. And over the next few weeks, we'll be sharing even more information about how our university operates under COVID-19. The goal is to maximize our mission while keeping our community members as safe as possible. And the resilience framework will be our guide for learning, serving, and working over the next academic year. This framework is not an emergency response plan. It's a management plan, and we will use it over the long term. And it will help us to stay flexible so that Pitt is still Pitt, regardless of what course this virus takes.
The University of Pittsburgh is reinventing our operations to keep the Pitt community as safe and healthy as possible while continuing to challenge the frontiers of knowledge and build a better future for humankind. All of our planning is built within the resilience framework, which combines a constant monitoring of conditions on our campuses and the prevalence of the virus with a set of universal health rules to help keep us safe and foundational principles to guide our operations. There are 4 key components of the resilience framework: monitoring the conditions around us and the activity of the virus to make informed decisions about how freely we are able to operate. This monitoring will influence the decision about our 3 operational postures, how restricted our operations must be. Like Pennsylvania's red, yellow, green phases, these postures define what is allowable across our people, places, and programs. When at highest risk, decisions are made by the university's senior leadership. When risk is lower, most decision-making happens within schools and offices. While we depend on Pennsylvania's phases as a minimum, we will customize our operational posture based on the risk we're measuring in our communities. In the resilience framework, there are 2 additional elements that guide us: university-wide standards and guidelines, activity area plans, which are tailored to the individuality and unique facets of a campus, school, unit, or department. To help guide our decisions, the Healthcare Advisory Group was created and is comprised of world-renowned experts, all of whom are Pitt faculty or staff. Their health sciences, safety, and public health expertise is varied and valued by local and state agencies.
Our Healthcare Advisory Group is defining health standards and guidelines for people, spaces, and activities across every campus, and for each operational posture. As part of our efforts to promote a healthy Pitt, we are requiring everyone to wear a face covering on campus. We are also asking you to practice social distancing in common areas and use good health hygiene. On our end, we are re-engineering spaces around campus to ensure that you'll be able to maintain 6 feet of separation from others at all times. And we are developing robust virus monitoring, testing, and contact tracing plans, which you will be learning about in the coming weeks.
In the weeks ahead, we'll be sharing more standards and guidelines as they're approved. For now, however, you can learn more about our resilience framework and operational postures by visiting coronavirus.pitt.edu. Without a doubt, these last few months have been difficult, but I'm deeply grateful for your hard work, teamwork, and resiliency. And I'm so proud to be part of a university community that continues to rise to the occasion and to forge ahead. Thank you.